I want to move to introduce now our last speaker for this evening, and it's really an honor and distinct pleasure to have Tom Whitehead with us here this evening. So Tom is the co-founder of the Emily Whitehead Foundation. He's also the father of Emily, and so I'm going to obviously let you tell the story of Emily tonight. We have had, I think, as you know, Bruce Levine speaking here at other dinners with us. Carl June has also presented to this group. And so I think many of the people in the room are familiar with the story, but we really want to hear about it from you. So if you could come to the stage and share your experience. Thank you.
So I'd like to, thank the Alliance of Regenerative Regenerative Medicine for having me here tonight and for making such a difference. Sometimes it's hard to get started, but I'm here tonight to share with you the story of how my daughter Emily, became the first child on Earth to have her immune system trained with T cells to beat her leukemia. So Emily was born on May 2nd of 2005, and she was perfectly healthy. She weighed 10 pounds, and she stayed healthy till just after her 5th birthday. So we took her to a standard, checkup at her pediatrician, and just 2 weeks before she was diagnosed. And her doctor checked her over and said she looks perfectly healthy, and things are good. So leading in then, right after her 5th birthday, going into Memorial Day weekend of 2010, Thursday of that week, Emily was fine. My wife noticed that she did have a lot of bruising on her body. She even called me the night before and said that Emily had 21 bruises when she put her in the bathtub, so she was really concerned. But we decided that we would just take her to the doctor the next day. And really overnight that night, she had severe leg pain through the night. And by morning, she was having so much pain that she was crying and saying something was wrong. And on May 28th of 2010, she was diagnosed the next day, which was Friday going into Memorial Day weekend, with leukemia. So we went from the picture on the left is the last picture we have of her before she was diagnosed, and just within the same week, then we were checked in at the Penn State Hershey Medical Center, and like I said, she was told that she had leukemia, and we were told in the beginning, though, that if your child has to have cancer, this is the one that's the most curable. So they said this is the garden variety type of leukemia. And if you listen to what we tell you and you follow the chemotherapy regimen, that she should be better in about 26 months. And she's going to grow up and be a grandmother, and she's going to have a good life. So we got started, and she had a very rough start. They told us she had one of the roughest induction phases that they had ever seen. But after the first month, she did get into remission. So we were very thankful for that, and she remained in remission for the first 16 months. She was sick quite a bit during that time, spent a lot of time. Some of the doctors said it was the most inpatient they had remembered for somebody that the chemotherapy was working for. But we were to the point where we were doing the maintenance chemotherapy, and we were taking her to get routine blood work up home. We're in central Pennsylvania, close to Penn State's main campus. So we have a local pediatric oncologist there, Dr. Powell, that would check her blood in between and send the results down to Hershey where we were treating. And the day before she relapsed, Emily announced to my wife's aunt who was watching her, she said, man, Kathy, I'm pretty sure I have blasts growing in my bones again. And Kathy told us that night that we weren't even talking about her cancer today, we were just playing, and she thinks that she's relapsing. So we were very nervous and went to the doctor, and Dr. Powell checked her over and said she's fine. She looks good. There's no problem today. Take her home, and we'll check the blood. And within 24 hours, the next day, I was at a meeting, and he called me, and he said, I've tried to discount this overnight. We've had every specialist we can have look at it, check it, but we're pretty sure we see cancer growing again in her blood, so you need to get her bone marrow checked right away. We went the next day and checked her bone marrow, and they come out and said that she was in full relapse. So this was around October of 2011. At that time, as soon as they said that the relapse was happening, they said, you just went from an 85 to 90% chance to now she's high risk and less than a 30% chance of survival. And the recommendation was to identify a non-related donor and go to bone marrow transplant. So since things weren't going according to plan, we decided to go online, and we filled out a second opinion referral to the Children's Hospital of Philadelphia, and thought it'd be a good idea to get another opinion in case we needed it, in case they didn't agree with what the next step was. So we were pretty surprised that within 24 hours, Dr. Susan Reingold from CHOP called us and said, bring Emily down and we'll check her out. So we went down and we met with her and took her records, and she checked Emily over and said, at this time, Hershey suggested going to a bone marrow transplant. We're going to do the same treatment that they're going to do. You can pick either place that you want to do it. But at the time, Hershey was 2 hours from home, and Philadelphia is about 4 hours from our home. And Emily was comfortable with the staff at Hershey that she had been with, and said, I'd really like to stay at Hershey. So we decided to go back there. And Dr. Reingold said, we're totally fine with that, and if you ever need us, we'll be here tomorrow. So we went back and started to prepare for bone marrow transplant. And the doctors were hoping to get the donor to come in the first week of February of 2012. And the donor said they weren't available till the last week of February of 2012. So they said, we're going to have to put Emily on hold until the donor's able to come in. So they gave her some pretty heavy doses of chemotherapy, and she was in remission at the time, but about 2 weeks into February, they took her in to check her bone marrow to make sure that the transplant had the best chance of working, and they come back and said, unfortunately, Emily's cancer is growing again, and it's growing fast. So right around that time, we went back down to Philadelphia again before we started any more chemotherapy. And we said, do you have anything experimental to give her? Because we know at this point chemotherapy isn't working. And they said, today we have a trial to offer that is a mixture of chemotherapies and then a new experimental drug. Or there's this T-cell therapy that we're very hopeful, but it has not passed FDA approval yet, and we don't think it will in time for Emily. So we researched the first trial they offered and decided that our instincts felt like it wasn't right, and we turned it down and went back to Hershey. And when we got back there, they changed the chemotherapy that they were going to start and gave her what CHOP suggested minus the experimental drug. And that bought us about 3 more weeks. And finally, our doctor at Hershey came in one morning and said, unfortunately, Emily is getting close to the end, and all we have left to offer you is hospice. And we don't think, we don't have any weapons left to fight her cancer. So I told him, when he told us that we don't feel that hospice is an option for us right now. We're not done fighting, and that we're going to transfer her full care down to the Children's Hospital of Philadelphia. So we called Dr. Reingold and paged her at her house on a Saturday. And luckily, she took the page, and I said, we don't know what you have to offer, but we're coming down no matter what, because Hershey can't fix her. And she said, well, just before I left for the weekend, they told me that the T-cell trial was approved. Cleared the paperwork with the FDA, and we think that she would be a great candidate to be our first patient. So we went down, and Dr. Grupp brought his team in. Dr. Stephen Grupp was who was in charge of the trial at CHOP. And he came in and explained to Emily, he said, Emily, we're going to take your T cells out of your blood, and then we're going to send them to the lab, and we're going to send them to boot camp, and we're going to train them to become an army that knows how to go in there and fight your cancer. And he said to us, as parents in the hallway, he said, I can't tell you for sure that this is going to take away her cancer, But I can tell you that we do use HIV in the process in the lab to train her T cells, and we can tell you for certain that we don't feel she can get HIV from this. We knew we needed something outside the box, and we knew chemotherapy wasn't going to work, but I had a deep feeling inside it no matter what, Emily was going to beat that. And I told her from the very first time she was diagnosed, I picked her up and said, Emily, only the strongest kids in the world are picked to fight cancer, and you are going to beat this no matter what, and you're going to be a hero when you beat it. So after Dr. Grupp explained that to us, I said, you know, surely somewhere in the world this has been tried on another child. And he said, no, it hasn't. She'll be number one. You know, so we agreed pretty quick to get the consents. We knew we were down to, within a couple weeks, they said that she probably wouldn't be alive. And once we signed up, Emily had to get the apheresis catheter put in her neck. And this is an actual picture of them collecting her T cells. And then she had to stay in her room for 6 weeks in isolation while they grew the T cells. So part of our role as a family was each day she had to smile at least once. So we had to get pretty creative each day with some way, and we used a lot of bathroom humor to try to get her to laugh. But I would do whatever it took to try to get a smile out of her. It was a rough 6 weeks, but we were pretty happy when finally Dr. Grupp came in and said on April 17th is the date we're picking, and over that 3 days we're going to give Emily her T cells, and they're ready to go. So we were nervous the whole time, or rather her T cells would proliferate and grow. That was tough waiting, and the 6 weeks was pretty grueling thinking about what if it isn't going to work. But we stayed positive, and as a family, we all stuck together. And then on the right is her getting her first dose on April 17th, and then they gave her a certificate acknowledging that she was the first child to ever receive T cells. So April 17th, they explained to us that they had to give her 10% of the dose, and then the next day they gave her another 30% of the dose. We were out of the hospital the first night, an outpatient, and stayed close by in Wilmington, Delaware at my sister-in-law's house. She was having fun, laughing before we went to bed. On day 2, we went to bed. She was feeling good, and around midnight she spiked a fever. So we weren't comfortable at that point being in the hospital, so we took her, or being out of the hospital, so we took her into the ER and spent the night. And of course, as soon as we got to the ER, her fever went away. She felt good overnight. We were joking around. And Dr. Grupp came in the morning and said, you know, she looks good, she feels good, and we'd like to give her the final 60% of her dose. So they gave her that dose, and then over the next 24 hours, things really spun out of control. Emily spiked a fever of over 105 and kept it for over 3 days. She started hallucinating in the room and asked us why there was a pond in her room. And by the time they recommended that the PICU team come down and consult, we knew that she would be headed there. Her blood pressure was dropping. She was having trouble breathing. And they come down, and the pediatric intensive care unit team took her directly upstairs. And the attending on that night said, you know, we're going to have to fight to keep her alive. So Emily was in so much pain that she couldn't take it anymore, and she was swelling up to the point where she wasn't recognizable. And I said, you know, they're going to put you to sleep now. They're going to put you in a coma, and you just keep fighting because you're going to beat this no matter what. And she shook her head and acknowledged that, and she was glad because she couldn't take the pain anymore. And they put her into a coma and put her on the ventilator, and she said, you got to promise while they work on me that you won't leave and you'll keep touching me. So I promised her that I would stay in the room, and then I watched, you know, a team of many doctors come in, and they cut in lines on both wrists and in her neck and in her thigh. And by the time they were done, they had 17 IV pumps keeping her alive. So she went into that coma, and at one point, the pediatric intensive care unit doctor came in, and he said, you know, almost every child that comes in to our unit that gets on a ventilator comes off, but unfortunately, Emily's probably not going to be one of them. You should call your family in. And I said, well, please don't quit trying, because she's going to beat this, and she's still going to be here when you come in tomorrow. And he said, you have to understand you're nowhere close to 1%. There's about a 1 in 1,000 chance that she's alive in the morning. And I said, well, I'll see you in the morning and she'll still be here. So he came in the next day and she made it through the night, and he said it's kind of hard to medically explain how. But we remember at some point that morning, Dr. Grupp came through the door and he said, we've had the lab working on Emily's blood and we're getting back results in 12 hours that usually take 5 days. So we're getting real-time answers, and there's a protein that's super elevated in her system. It's called IL-6. And Dr. June was part of the email chain studying this, and he had researched that the arthritis drug tocilizumab will shut that off because his daughter has rheumatoid arthritis and he thought she might need the drug. So he said, can we try that on Emily? It's never been used in a cancer patient before. And we said, absolutely, we know that she needs something to survive today. So we gave her a dose of that medicine. The nurses come in and gave it to her, and within 12 hours, she was making a dramatic turnaround. And the doctor said afterward they've never seen anyone that sick get better any faster. So she ended up being in that coma for 14 days. And at some point in those days, Dr. Grupp came in one morning with a little bit of a smile, and he said, we're cautiously optimistic, but we see her B cells are disappearing in her blood. So we got pretty excited about that. And then finally, after 14 days, Emily woke up on her 7th birthday, and that was on May 2nd of 2010. And then on May 10th, they took her back in and put her under and checked her bone marrow, and it was, I think it was 23 days after her first treatment. And they still had her under and took her to CAT scan to check to make sure she didn't have a fungal infection. And when she was coming out of the CAT scan machine, my cell phone rang, and it was Steve Grupp. And he said, I answered thinking something bad was coming because he wasn't in town. And he said, Tom, this is Steve Grupp. I'm in New Orleans at a conference, but I wanted to be the one to tell you it worked. So she was completely cancer-free. Yeah. So it was the best. It was really the best call I'd ever received. So that was on May 10th. We took her home on June 1st. We had to teach her to walk again from the coma. She lost a lot of her muscle. That August, she went back to school on time, and the doctors were telling us this is a really big breakthrough in cancer research, but we can't talk about it until we get peer review. So we were allowed to talk about it, but they needed to get through peer review before they were allowed to put it out to the media. So we had a normal life for the next 6 months while she was healing. Normal because we were out of the hospital. That became normal for us, just to be out of there. And then during that 6 months, we were contacted by an Oscar-winning film director named Ross Kaufman, and he said, GE has given me funding to make a short film about scientific breakthroughs. Could I make it about Emily? So I said, sure. And he said, I'm going to make it, and then we're going to release it whenever the embargo comes off the story and the hospital's allowed to talk about it. So he made the short film. We became friends in the process. And the first week of December of 2010, we were interviewed by the New York Times, and Denise Grady came and interviewed us, and then they said, she called me that weekend and said on Monday, on December 10th, Emily's picture is going to be on the cover of the New York Times. And the day before, I was talking to Ross on the phone, and I said, hey, it's going to be a good time to release your short video. Emily's picture is going to be on the cover of the New York Times tomorrow. And he said to me, he said, if that's true, your lives will change again tomorrow. And that was an understatement. So by the next morning, that picture in the middle on top there was the picture they used. That was on the cover. And I had a message from the New York Times that said, this is even bigger than we expected. They said we have 7,000 readers every 15 seconds. And by 9 o'clock that morning, we were receiving calls for media interviews from all over the world. The one that really made me realize that we were, not prepared, I had a call from the biggest morning show in Australia, and they said, we'd like to hire an NBC crew out of New York City and be in your driveway today at 4 o'clock with the satellite truck, and you'll be live in all of Australia to talk about Emily's treatment. So it was pretty overwhelming. And after the day that was in the New York Times, over the next 3 weeks, there was 550 articles written about Emily's treatment in the United States alone. And some of the pictures here are newspaper articles from other countries. Emily started to get coverage in magazines and TV. The first week it was in the New York Times, we had a visit from Diane Sawyer's crew for the Nightly News and Scott Pelley's crew for the Nightly News. And it's been amazing that our lives have changed that much since she got home. And what it also did is bring awareness to the world of other parents that had kids that chemotherapy wasn't working for them, and we started getting calls of how they could find a trial. So we've spent time since then telling Emily that your treatment is very hard to talk about, and, but it's too important not to. And a lot of times when I'm talking about it, I cry. But if she's here and she was watching me speak, she usually tries to make faces at me and make me laugh. So the bottom right there, now Emily's being included in microbiology books. And when they want to put her picture in a textbook or something like that, all we ask is that they send a copy for her, so when she gets older, it'll really mean something to her. And what she likes best about that is her dog Lucy made it into the book. So Lucy's in that picture. So she got home. You know, we're trying to make a difference. We're talking to families from all over the world, and we finally decided to start the Emily Whitehead Foundation in January of 2015. And we weren't sure if anybody was, you know, really noticing what we were doing. We were spending all of our spare time doing it. And we literally announced that we were starting our foundation, and the next night, I was at work on a 3 to 11 shift. I work for the power company. I'm the person that shows up when you're out of power. And I got a call, and they said, you know, President Obama was talking about Emily in the State of the Union when he said that they had bipartisan support for precision medicine. Can you bring her down to the White House for the press conference on Friday? And I said, does anybody say no? You know? So the one thing they told us was, Emily is not allowed to know. Don't talk about it till you come down, and don't tell her until you're in the car on the way down. So she was very frustrated that we were packing to go somewhere and couldn't tell her where we were going. She wasn't allowed to tell the school, and we weren't allowed to tell our work where we would be. And I just let them know that you'll know soon. But I asked them, I said, when Emily was getting better and we had to teach her to walk again, it was very painful. And I told her, this is such a breakthrough, and you're doing such, you know, you're pioneering this new treatment, and someday you might get to meet the president. So I said, you know, if I bring her down there, please make that happen. So they wouldn't confirm or deny that he would be in attendance. But when I made the request about an hour later, we were told in an email that when you get to the White House, there'll be 200 people having coffee and tea, and if you go over by the JFK painting, Secret Service will come and get you and take Emily to another room where we will not confirm or deny who she might meet. So we went down in the morning, and when we got in the car, we told Emily where we were going. So she was pretty excited. We got to go in, and President Obama came in, and I started to explain to him about Emily, and he said, Tom, you don't have to tell me about Emily. I know all about Emily. And he said, the whole world knows about Emily. And he said to Emily, it's an honor for me to meet you. And he said, is there anything I can do for you today? And she said, well, I need an excuse for school. So that was the actual, he wrote that out and said, please excuse Emily from school. She was with me. So she was pretty proud of that, and the principal accepted the excuse. So, you know, so we've been home, and since all of this has been going on, we've gotten to travel all over the world now. Last summer, we were able to go to Switzerland and France and spread some awareness about that, and then also have fun. And we tell people, if you want us to come and speak about her treatment and she's with us, then you have to do something fun for her. So a few years ago, we were at the Cancer Research Institute gala, and Sean Parker came up and wanted to meet Emily. And he promised me then, he said, I'm going to make a big difference in Emily's research and in immunotherapy in general, I'm going to bring hundreds of millions of dollars to it. So I said, well, I hope you keep your word. And then just a few months ago, I got a message that said, well, we're ready to start. Would you bring Emily to my gala in Beverly Hills? So I didn't have to twist Emily's arm too hard to go to California. We shot a new video about her story that was played that night. This is an actual picture. Emily was hanging out with Katy Perry in the crowd at the gala, and Sean featured her, and just we liked having the opportunity to spread to Hollywood and to the world about how much funding this needs, how much more awareness, and we really had a chance to talk to a lot of celebrities to try to get them on board with bringing that awareness with the platforms they have. So during that gala that night, Emily was in the crowd hanging out with Katy, and then Lady Gaga called her on stage and sang to her. And when she came off the stage, Katy said, "Emily, you're so popular, I don't feel worthy to hang out in your crew. Will you take a selfie with me?" So this was the picture of Orlando Bloom taking the picture of Emily and Katy with her phone. So my wife and I were sitting in the crowd, and a lot of tears were flowing, and it's very surreal for us. There was times 4 years ago when we were fighting to get minute to minute, and since she got home, I told her in the beginning that if you believe you'll get better, you will. So we're at the point now where Emily has blocked out the painful part of her treatment, but she can still remember the good times she had and the fun she had at the same period. And when we got home and started our foundation, I said, we got to do something to help these other families. Emily lost at least 6 friends in the hospital that she played with and became friends with, and then they didn't make it. And when we started our foundation, she said, I would like to help because I don't want any more of my friends to die. So we're very motivated to keep going. We feel blessed for every day we get with her. And on May 10th here this past month, Emily just became 4 years cancer-free. She turned 11 years old on May 2nd. And each year we take a picture of her cancer-free on her anniversary. And she said this year she would pose as long as her dog Lucy got to be in the picture. So Emily's thriving. Last night she had an awards ceremony at school, and she was given for all 4 subjects in school. She was in the top 10 in 5th grade. She finished advanced in all of her subjects last year on her standardized testing. And she's also very proud that in the first year we were able to raise $100,000 for our foundation, and then she gave the check to Dr. Grupp, and he's using the funding to grow T cells for the next kids that need it. So again, we're very blessed for every day we have with her. I wish my wife and I could forget, like Emily does, what happened, but that also motivates me to keep making a difference. So I told Emily when she got home, we're going to spend the rest of our life surrounding ourselves with positive people that make a difference. So it's a real honor for me to be here tonight, and thank you all for what you're doing.
Thank you. Thank you, Tom. I mean, that's an incredible story, obviously. What's neat is that, aside from the fantastic outcome, is that for those of you who were here a few years ago, we saw Bruce Levine do a video about Emily, and she was still a very little girl, cancer-free, but a very little girl. And so we talked today at the immuno-oncology roundtable about the progression and how, each year we see more and more success and more things. And so it's really the personification of that we went from, she was little, and now we have her dad here talking about how well she's doing at age 11. So it's fantastic.